Your newborn's delicate skin can sometimes surprise you with spots, bumps, or even strange patterns that look alarming. But did you know that most of these rashes are completely harmless? In this video, I'll walk you through some of the most common benign newborn rashes, what they look like, why they happen, and when you should and shouldn't be concerned. I'll also point out a few red flags so you can spot the rare cases that might need a doctor's attention. Let's get started. A newborn's skin is incredibly delicate and is adjusting to life outside the womb. That's why rashes are so common during the first few weeks of life. They can appear for several reasons. The sweat glands are still developing, maternal hormones are still circulating in the baby's system, and their skin can react to things like heat, clothing, or even detergent. Thankfully, most of these rashes are harmless and go away without any need for treatment. Let's go through 10 of the most common harmless newborn rashes so you can feel confident about which ones don't require treatment and which ones might warrant a closer look. Erythema Toxicum Neonatorum, ETN. ETN is one of the most common newborn rashes affecting nearly half of all babies. It usually appears 2 to 5 days after birth as red blotches with tiny white or yellow pustules, often found on the baby's face, chest, back, or limbs. The good news, it's completely harmless and goes away on its own within a week or two. There are no red flags with ETN, no need for creams or medications, just let it resolve naturally. Transient Neonatal Pustular Melanosis, TNPM. TNPM is more commonly seen in babies with darker skin. It presents as small, fluid-filled pustules that burst and leave behind dark brown spots. These spots are usually present at birth and fade away over the next couple of weeks. No treatment is needed, and there are no concerning signs to watch for. This rash is entirely benign. Neonatal acne, acne neonatorum. Neonatal acne shows up in about 1 in 4 newborns. It typically appears around 2 to 4 weeks of age, showing up as small pimples or whiteheads, mostly on the cheeks and nose. It's triggered by maternal hormones and usually clears up by 2 to 3 months without leaving any scars. If acne persists beyond 6 months, it could be a sign of infantile acne, which may require a pediatric review. But in the early weeks, no creams or oils are needed. Gentle cleansing is more than enough. Milia. Milia are tiny white or yellowish bumps that often appear on a baby's nose, cheeks, or chin. They affect about half of all newborns and are caused by blocked skin pores. They don't itch, hurt, or spread, and they usually go away on their own within a few weeks. There's no need to apply creams or try to pop them. Just leave them alone and they'll disappear naturally. Miliaria heat rash. Miliaria, or heat rash, usually occurs in hot and humid conditions, and it shows up as red, pinpoint bumps, most commonly on the baby's neck, chest, or back. It happens because the sweat glands are blocked and can't release sweat properly. It clears quickly, usually in a day or two once you cool the baby down. But if the rash is widespread and your baby has a fever or appears unwell, that could suggest an infection and should be checked by a doctor. Salmon patches, angel kisses, stork bites. Salmon patches are flat, pink or red areas seen on the forehead, eyelids, or the back of the neck. They're present in nearly a third of newborns and become more visible when the baby cries or gets warm. They're completely harmless and usually fade on their own within the first couple of years. No treatment is needed, and there's nothing to worry about. Cutis Marmorata. This rash looks like a bluish, lace-like or marbled pattern on the baby's arms or legs. It's due to immature blood circulation, especially when the baby is cold. Once the baby warms up, the mottled appearance fades. If it doesn't go away or is accompanied by other symptoms like lethargy or poor feeding, it could indicate something more serious, such as sepsis or a congenital issue, so in those rare cases, seek medical attention. Normal desquamation, peeling skin. Peeling skin is very common, especially in post-term babies. You'll often notice dry or flaky skin on the hands, feet, or ankles. This natural shedding of the outer skin layer usually resolves in a few weeks. Gentle moisturizers can help if the skin looks very dry, but most of the time, no treatment is necessary. However, if the peeling is excessive and there's redness or signs of irritation, it could be eczema or an infection. Check with your pediatrician if that happens. Sucking blisters. Some babies are born with blisters on their fingers, wrists, or hands, usually from sucking on them in the womb. They're clear or occasionally tinged with blood and typically disappear within a week or two. If your baby only has 1 or 2 isolated blisters, it's nothing to worry about. But if there are blisters all over the body or your baby seems unwell, it could indicate an infection or a rare genetic condition. And that needs medical attention. Mongolian spots, dermal melanocytosis. Mongolian spots are flat, bluish-gray patches that commonly appear on the lower back or buttocks. They're more often seen in babies with darker skin tones. These spots are harmless, don't cause any discomfort, and usually fade on their own by school age. It's important for parents and healthcare providers to document these spots early to avoid mistaking them for bruises later on. There are no red flags, no treatment is needed, just awareness. Benign newborn rashes usually appear in the first few weeks. Don't involve fever or systemic symptoms. Resolve on their own. Red flags to watch for: widespread rash, associated fever or poor feeding, persistent rash beyond expected time, blisters all over the body. When in doubt, always ask your pediatrician, but most of the time, there's no reason to worry. I hope this video helped you understand the most common harmless rashes in newborns and when it's okay to just watch and wait. If you found this helpful, please hit the like button, share it with other parents, and subscribe to the channel for more baby care tips and pediatric advice. See you in the next video.